Thank you, Mr. Chairman. I'm thanking the witnesses for being here today. When I left Walter Reed as a patient, I left with a CD-ROM with my entire records, including the notes from the surgeons who performed my amputations. In order to get into the VA system, I had to wait 90 days for an appointment, and that consisted of me going in to see a physician's assistant for whom I had to disrobe to show him that I was still an amputee, that in those 90 days my limbs had not grown back. Now, in that time period, that physician's assistant did not want to see me. He had other patients to see. There was a backlog of patients waiting to be seen. He was not able to just accept DOD's records. And so it was a waste of time for him. It was a waste of time for me. It was a waste of resources for other veterans. I say this because as a patient of the VA and as a former patient of DOD, I am proud of both healthcare systems, and I am proud of the people who work in both systems. But I am also equally frustrated by both sides because I have been a member of the leadership at VA. In fact, my frustration with this very issue is one of the reasons that I quit VA in 2011 to go run for Congress, because of the posturing, the inability to work with each other, and the continued strife and the waste of sheer taxpayer dollars. It's literally one of the reasons why I ran for office, because I sat in those meetings every week at the Pentagon where, let me tell you, from my personal opinion, Tammy Duckworth's personal opinion, the VA got rolled by the DOD on a weekly basis. Mr. Miller, what you can tell your folks about, your clinicians about what you can do to get them a good system is not wait 5 years. You can tell them we're going to adopt VISTA, and then together, while we're using VISTA, we can work towards something else. That's how you get them a better system immediately. But let me tell you that I was there week after week, and then when it went on to months, there would be a new 1-star or a new 2-star who would rotate in, the old one would leave, and the new one would come and goes, oh, I need a new study, you know, because I wasn't here for all of those weekly meetings. I need a new study. We need to figure out what's going on. Ms. Counsel, I know that you testified earlier, I was watching from my office, that you have to actually send the data from one VA hospital to another in order to be able to see that. I have to tell you that you've undersold VA a little bit, because I've gone to different VA facilities and actually have had my doctors know how to log out of the system for that hospital and then log into the correct system and been able to see my records, which has been very helpful. And following Hurricane Katrina, veterans who were affected by Hurricane Katrina could actually go to other VA facilities and get the prescriptions they needed wherever they were, whether that was in Texas or Missouri or Mississippi, wherever they ended up, they were able to get. So there's a way for that to happen. But look, this is about a longstanding, deeply embedded culture that prioritizes in both agencies turf battles over the well-being of our service members. It's about a VA system that struggles with the growing demand for the Department's medical services, that is burdened by policies and written rules that says you have to go in to see a physician's assistant before he can confirm that your legs didn't grow back. I'm not a gecko, but they don't grow back on their own. It's also about the fact that we're wasting hours and resources to conduct medical examinations. We should be treating veterans. It's really been disheartening for me personally to watch the massive DOD bureaucracy repeatedly, and I say this again, repeatedly roll VA over and over and over again, which, despite its serious problems with VA has real problems. It was actually one of the earliest organizations to implement EMRs. I just finished my PhD in October, and the topic of my PhD was actually electronic health records. And it was partially inspired because of my work on this issue. It was even more shocking to watch DOD not only roll VA, but roll the Office of Management and Budget, which pushed in vain early in the administration to convince DOD that it needed to work with VA to develop a single integrated electronic health record system. And to this day, I harbor serious concerns about the decision to abandon a goal of a unified, single integrated system for DOD and VA. If we're going to spend $11 billion of taxpayer money, I don't understand why we wouldn't have invested this astronomical amount of money in a fully functional, interoperable system. Now, having served on the committee on this committee and the Armed Services Committee, I have my suspicions about the motivations and incentives that explain DOD's longstanding unwillingness to work with VA to modernize and enhance VISTA to meet 21st century healthcare needs. And I'm not going to get in an argument with you. My personal opinion is everybody's got bureaucratic turf battles. Everybody's got a budget that you would like to hang on to and to supervise. That stuff has got to end because veterans are suffering. So my question is actually to Ms. Melvin. In your testimony, you noted that neither DOD nor VA could substantiate their claims that maintaining two separate EHR systems would be less expensive than developing a single integrated system and would be developed faster than creating a new unified DOD-VA system. Is that correct?
That's correct.
So they're not able to substantiate it?
They were not able to provide us the information. We recommended, I should say, that they provide or develop cost analyses for, cost estimates for the alternatives, the alternative to develop a single system as well as the new two separate systems, and to compare them and to provide information to us relative to which was the more viable solution. We'd like to see the justification for why going back to two systems is better than one system. That's very important to really the bottom line of whether this is a more reliable approach that they're taking over what they had been going with before.
Are you expecting that information anytime soon?
I don't believe we are. I don't think that we have any date yet to get that information. We are still working with them. We do still have our recommendations on record related to that, so we are still coordinating with the agencies about that.
Mr. Chairman, I'm well over time. I apologize. But may I request that the two agencies provide that information to this committee?
Ma'am, we have provided that information.
If there are no objections, with unanimous consent, please submit the information that Ms. Duckworth has requested for the record.
Thank you, Mr. Chairman. I yield back.